Hello and welcome to the Biopsy Consent Consultation. Here we will take you through the procedure using a staged scenario between a doctor and a patient. It should give you an insight into the procedure and how it should be conducted. Prior to this appointment, the patient should have been offered patient information resources to read that outline all the information needed to inform them of the procedure. However, this is not always the case should a same-day biopsy be performed. So always check that they receive this information during the consent procedure.
Good morning. My name is Dr. Sally Aziz and I'm one of the dermatology registrars. Before we begin, please may I confirm your full name and date of birth?
My name's James Keenan and my date of birth is the 17th of March 1989.
Thank you. I'd like to clarify what procedure you are scheduled for and give you the chance to ask any questions before we begin. Is that okay?
Yeah, that's fine.
Thank you. You have been referred for a medical procedure called a punch biopsy of the skin. This will involve taking a small sample of skin from your leg so that it can be examined under a microscope. It is important that we discuss the benefits and the risk of this procedure before you decide whether you would like to proceed, and also answer any questions that you may have. After the sample of your skin has been taken, it will be examined in detail under a microscope. This will help us to understand more about your skin condition. I will first confirm the site of the biopsy with you, and then we will mark the skin to show this area. I will then inject local anaesthetic to that area. This may sting for a few seconds, but the area will soon feel numb. I will then go on to take the biopsy. You might feel a little bit of pulling or a bit of pressure, but it should not be painful. Once a sample of skin has been taken using the punch biopsy, I will then close the wound with stitches. Finally, I will put a clean dressing over it. Overall, it should take about 20 minutes or so.
Yeah, that's fine.
A skin biopsy is a low-risk procedure. However, it is important that I tell you about a few potential risks involved. You may experience some discomfort at the site of the skin biopsy once the local anaesthetic has worn off. If the area is uncomfortable, you may take simple painkillers like paracetamol, as long as there is no reason you are unable to take this. We do advise against ibuprofen or aspirin if not prescribed, as this can increase the risk of bleeding following the biopsy.
Okay.
There is a small risk of excessive bleeding from your wound. Before the procedure, I will ask you about any regular medications that you take that may increase your risk of bleeding, so that I can take the necessary precautions. Although I will perform the biopsy under sterile conditions, there is a small, less than 5% risk of an infection at the wound site, if there are no other risk factors for infection. If the wound becomes painful, hot, or swollen, this may be a sign of an infection, so please contact us or your GP as soon as possible, as you may need antibiotics. A permanent scar will develop at the site of the skin biopsy that will be approximately the size of the biopsy. Rarely, the wound does not heal well. This is more common if you have underlying medical problems or if you smoke. Healing is generally slower on the lower limbs. Whilst the skin biopsy usually provides us with useful information about your skin condition, sometimes we are not able to give a definite diagnosis, and so we may consider further investigations. Do you have any questions? Leave the dressing on and keep the area clean and dry for 2 days. Then, remove the dressing and gently clean the area with soap and water. If you cannot use soap, just use water. Pat the wound dry and apply a thin layer of Vaseline taken from a new pot. Then apply a dressing to protect the wound. You can continue to change the dressing every 2 days until the stitches are removed or the wound is completely healed. We may ask you to see your GP practice nurse to remove the stitches if needed. Do you have any questions about any of the information that I've covered or anything to do with the skin biopsy?
Oh, that's all really clear. I do have one question. Can I still exercise?
We advise to minimise strenuous physical exercise to avoid stretching the stitches and avoid swimming or soaking the wound, including a bath, whilst the stitches are in. Do you have any other questions?
No, thanks.
One final thing, we need you to consent to the procedure. So if you're happy with everything I have said, please would you sign, print and date at the bottom of this page. I will sign the consent form too.
If the patient has previously provided written consent, you can confirm this consent is valid with them and sign the bottom part of the form. This now concludes the biopsy consultation and the patient is ready for the procedure. Thank you for watching.